Welcome to Test Taking Tips for Nursing Students. This video was developed after several years of meeting with students about failed exams and noticing patterns of problems. I created Pocket Prof Nursing because as a nursing professor, I know how hard it is for students to get what they need from all teachers. We don't intend to replace your professors, but we hope to provide more resources and different perspectives to help deepen your understanding. So what's different about nursing tests? The first thing is that nursing tests really require critical thinking. Your answer should not be able to be found on just one page in the book. So, usually when you take a test, you could go back to one page in the book and prove an answer wrong to a professor. But in nursing school, especially when you get to Med-Surg 2, but even in Med-Surg 1, we hope that you would have to look on multiple pages of the book to be able to find the answer to that, because we want to make sure that you have multiple levels and layers of understanding of the material. So with that being said, memorizing rarely works. You really have to understand the information. This is really different from your core college courses that you took, where you could cram and you could memorize and take the test and forget that information. But as you see here, this picture with that whole stack of books, think of that as all the books for all the courses you're going to take in nursing. And the truth is, all of that information could be tested on the NCLEX. And you can't possibly memorize all that information from all of those books. So it's really, really important that you understand and not just memorize. And you'll see other reasons why as we move forward in this presentation. Now, there are sometimes areas that you just don't get. So maybe it's endocrine and you just can't understand the information. So in that case, you're going to have to memorize that. And that's okay if it's just one area. It's not okay if it's everything in nursing school. But if it's one area, just make sure you set yourself some extra time when you're going to have comprehensive exams or when you get to NCLEX to really review that category of information again. Next is a good news, bad news kind of thing. Great questions have at least 3 correct answers and you must pick the best one. Sucks, doesn't it? But here's the good news. We rarely have any great questions. Most of them will have 2 that are correct answers and you have to pick the best of those 2. And I know that's really frustrating and a lot of people have problems with that. And I address that much more specifically in the video, Why Did I Fail That Test? Reading the question, I have several slides about this. But first, read carefully and read all of the answer choices. I can't tell you how many students, when I'm reviewing an exam with them where they've missed questions and we're looking at individual questions and they get to one and they say, I just missed that word. I didn't read that carefully. So you know that instinctively, but really be careful. So when you look at this example, vaginal hysterectomy versus abdominal hysterectomy. So vaginal hysterectomy versus abdominal, you're going to have different symptoms. You're going to have different things you watch for after the surgery. So it's really important you pay attention to that because they're not going to have vaginal side effects if they had an abdominal hysterectomy. And that would be a question you'd feel really dumb when you miss that. The other one is reading all the answer choices. Oftentimes students will tell me, well, I saw that and I picked that answer. But remember, at least 2 answers are going to be correct. So if you don't go ahead and read the rest of the answer choices, you may miss the better answer. Underline keywords. So like in the above example, I would hope that you underlined vaginal or you underlined abdominal because that's a key word. Look at the one there. What is an early sign of hypoxia? So your keywords are early and hypoxia. What it does when you learn to underline is it keeps you focused. So yes, you read it. We all read it. You even notice that it's a keyword. But when you actually have to physically underline it or highlight, that helps keep you focused when you get down to those answers. The stem of the question contains clues, not distractors. Now, I'll tell you, there are sometimes instructors that don't do well with this. But in general, and definitely on your standardized exams, the stem of the question has clues. They're not distractors, not things meant to mess you up and not know what you're looking for. So look at our example here. A thin 82-year-old patient has a visible pulsation of the abdominal aorta in the epigastric area. So if we didn't pay attention to the 82-year-old and the thin, we'd be really concerned because a visible pulsation is not usually a good thing in the aorta. But in a thin 82-year-old patient, that is not at all unexpected. So age, if it's in there, should be a clue. If a sex, female or male, is there, that's usually a clue. So pay attention to your clues. Identify whether you're looking for positive or negative. This is another one that people tend to have problems with. And if you have a problem with this, get in the habit of doing what I'm going to suggest. So here's an example. What statement indicates a need for further instruction? And it's not always underlined. And even if it is underlined, you still ought to do this because a lot of people still make this mistake. So is this looking for a positive statement, a positive answer, or a negative answer? And in this case, it's looking for a negative. You might like the words true or false better, so then you underline further, and out to the side you're going to put false. What that does is when you go and you look at the choices, when you find an answer that you know is correct, like a person with a DVT should never have their legs massaged, you go, oh yes, that's right, and you choose it. And you've forgotten that it's not looking for a true statement, it's looking for a false statement. And to be honest and to admit to you our failings as instructors, we really shouldn't use these questions. But they're always out there. We all use them. You'll see them on standardized tests. Next thing, ask yourself what the question is really asking and what the answer choices really mean. What I find sometimes is that when I review a test with a student, they don't even really understand what the question is asking. So if you go look at NCLEX prep books, one of the first things they'll teach you to do is don't look at the answers, just read the question and see if you can reword that to make sure you know what it's really asking. Now the truth is, if we did that all the time, it would take too long to take exams. So you can't do it on every question, but if you have a problem with this, you need to practice this technique. So read the question and then make yourself say out loud what that question means. Think about it with answer choices too, though. So the question here says, it shouldn't be a question mark, it ought to be a period, but after tonsillectomy, implement measures to minimize crying. What's the point of that? Is that to say they're not having pain? Or is that because crying will make the patient bleed after tonsillectomy? You see what I mean by that? Another common one is you memorize because you don't understand. So you memorize that one of the common side effects of a lot of things is heart failure. But the test never says heart failure. It will say the patient has this process, what indicates a problem? And the answer is shortness of breath with exertion. Would you agree that's a symptom of heart failure? But you got to know that. You got to know that that is leading you to think of heart failure because it won't say those words. Finally, in this slide, if any part of the answer is incorrect, don't choose it. Again, common mistake students make. And I'll say, why'd you pick that answer? And they, I don't know. I'll say, did you like all of the answer? Well, no, I like the apply the anti-embolism stockings because everybody should have that. That's really important. But I didn't really like massage the legs. Well, if you don't like that part, that's not the correct answer. When you don't know something, don't panic. Go back, read the question, look for clues, look for things you do know. So many times you read a question like this one here. The patient scheduled for percutaneous coronary intervention. What is your first priority? And your first thought is, oh my gosh, I don't know what percutaneous coronary intervention is. I didn't study that. I don't think I've ever heard that word before. And the truth is you're going to get lots of questions on NCLEX and standardized exams that you don't remember. But I would tell you, you remember a whole lot more than you think you did. You know more than you think you do. So settle yourself down and look at this again. So percutaneous, what does that make you think of? Skin. Maybe per the skin or under the skin. Coronary, heart. Intervention, you do something. So this question's asking about something that's under the skin that you do for the heart. Now, you can probably take at least a better and educated guess instead of just a guess on the answer. Always, never, all, none, only, there's other ones. And you've learned this, but I'll just remind you, those are rarely correct answers. And I'll say rarely because there's probably that 1 in 100 chance that that's going to be some answer. But rarely. It should make you at least stop and consider other options. Now, I think it's funny. The next thing is never, 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 never change your answer. I can't tell you how many times I tell students this. Statistically, it doesn't work. Yeah, every once in a while you may find that it works, but statistically, it rarely works enough that we would say don't ever do it. So a lot of times I find students know this is a problem for them. If you know this is a problem for you, don't bring an eraser. And you think that's funny, but that really does work. I'll give students a little square eraser and say, don't use me on it. It's really just a matter of self-discipline and stopping yourself from doing it. You can always come back. You can always note that question, don't answer it, and come back to it. And you have to if you don't bring an eraser. Most questions have answers that are distractors. I just want you to know this. This is what you think of as tricks sometimes. And by distractors, I mean words we used in class that you recognize. Like maybe it's ICD. Oh yeah, I remember in cardiac we talked about ICDs, but I don't remember anything else about it. And the problem is you then choose it because you know we talked about that a lot. And so you say, oh, that must be the answer. And it has done exactly what it was supposed to do, and that is to distract you. Words are drugs that you don't know, but they sound good. Here's another common one, verapamil. So, you know we never talked about verapamil in class in that section of cardiac we're testing over, but you don't remember what that drug is, so surely it must be it. That doesn't even make sense to me, but that's what students commonly do. And then common phrases, maybe ABCs. So you know, oh, we always do the ABCs first, and so you see that in a question and you decide you better choose it. When you don't think about what is the question really asking, you just get drawn to that. Now, the truth is that when you get caught by distractors regularly, it's usually because you're not well prepared. That doesn't mean you didn't study enough hours. It just maybe means you didn't study well enough. And I address that in more detail on the video, Why Did I Fail That Test? The next thing I address on that video too, and that is reading into the question. Again, there are people that just have a problem with this, and it tends to be students that have a background in medicine somehow. You're a paramedic, or you are an LPN, or you're an aide, you work at the hospital. You tend to fall in this more than others, but this is just sometimes some people's problem. So generally, if you find yourself saying, well, maybe, but, or if I remember a patient, any of those things, then you are probably reading into the question. And I'll tell you how to stop doing that in Why Did I Fail That Test? So here's a couple of nursing test myths. So I've had a lot of students over the years say, you know, back in fundamentals they taught us this, and that's not always true. So that's what I'm going to address. So the truth is, if you're just going into fundamentals, you probably are going to have a well-meaning fundamentals teacher that is going to teach you some of these tricks. But the truth is they work well in fundamentals. They don't work well once you get in Med-Surg 1 and especially in Med-Surg 2. So what I want you to understand is they are not always true. So yes, in fundamentals, when you're just learning, you have very little knowledge. We're giving you some quick rules to pay attention to. But as you get further and you've got a lot more knowledge and we're expecting you to critically think, I want you to stop before you apply these rules. And you'll notice that all of them I use the term never, and so never means I got to stop and think about this a minute. So the first myth, notify the healthcare provider, is never the correct answer. That is not always true. Yes, you should look for other things. And the truth is, if there is an option to assess, to further assess, most of the time you need to further assess before you call the healthcare provider. But let me give you the example I have here. If your patient's blood sugar is 585, what do you need to do? You need to call the doctor. There's nothing you as the nurse could do to fix that. You need medical intervention, and there are several things like that. And in MedSurg 2, I oftentimes do test where this is sometimes the answer to see if they recognize when it's out of their hands. Now, MedSurg 1, it's usually a little bit simpler information, and we want to see what can you do as a nurse first. So please be sure you're hearing what I'm saying. Now, if in this same example the patient's blood sugar is 585, what do you do first? One of the options is call the healthcare provider. One of the options is assess your patient's arousability, their neuro status. Pick assess first because you want to know that before you actually call the doctor. Okay, the next myth, a risk for diagnosis is never a priority. This is also false. And you learn this in fundamentals. I've heard lots of students tell me this. And in fundamentals, that's probably true. You want to know, you're trying to learn how to make priorities and how to write your care plans. But look at this example. Your patient has had a stroke affecting his right side and causing swallowing difficulty. Which of the following diagnoses is your first priority? Impaired physical mobility, risk for aspiration. Would you agree? The risk for aspiration is a bigger priority than the impaired physical mobility in this instance. That's my point. This is where you need to use critical thinking. A couple more, and these are a little more confusing, but again, in fundamentals, we're trying to teach you the basics. We're trying to see, do you know when you need a doctor's order and when you don't? Do you know what a nursing intervention is versus a nursing assessment versus an evaluation? We're testing for a purpose. But as you move on further, we expect you to already know that. So MedSurg 1 and MedSurg 2, this is oftentimes applicable, these myths. So when the question asks for a nursing action, never choose meds or interventions that have to be ordered by the physician. This is false, especially when you get past fundamentals. Prepare the ordered Lasix. That says that it has been ordered. Sometimes it'll say prepare, expect to give this. That's okay too. So we're not trying to test you to see if you know that you have to have an order before you do something. As you get a MedSurg 1 and MedSurg 2, we're testing to see if you know what you're supposed to do or not, or if you know what to anticipate is going to happen or not. So be sure that you're reading the question and making sure you know what the question's asking. We're not trying to trick you in MedSurg 1 and 2 to see if you need an order. Same thing with the next one. When the question asks for nursing action, never pick an assessment. Or when it uses the term intervention, you can't pick something like assess the patient's breath sounds. Now, come on. Think to your care plans. In care plans, you all the time put assessment as an intervention. That's because it is. You're taking an action. You're doing something. But again, in fundamentals, we're testing a different thing. We are looking to see, can you recognize the difference between an assessment, intervention, and evaluation? Once you get past fundamentals, we think you have that. And now we're looking to see, do you know what it is important that you do? Dietary questions. I was hoping to find some more to put on this, but this is the primary one I think of. And the truth is, NCLEX has a ton of dietary questions, and most people hate them. So one trick that I've learned is identify the primary food component, like protein or fat or salt, and then apply that to the specific disease process. So in this example, Your patient has renal disease. Which of the following meals should be avoided? Fried chicken and ice cream, milk and Chinese food. Now, we'd probably all agree that none of those are the best thing. But fried chicken and ice cream, what's the primary component we're concerned with here? Probably fat. Milk and Chinese food, probably sodium. Remember, dairy has lots of sodium. So your patient has renal disease, that's your key word, and which of the meals should be avoided, another key word. So in this case, it's not the fats we're looking at, it's that sodium. Last thing I'm going to cover is anxiety. Oh no, I have two things. So anxiety. Lots of students have problems with this, so I'm just going to give you several tricks that I've seen used over the years. Be prepared. It goes without saying, if you're not really that prepared, by the time you get there to take that test, your anxiety is very high. So as much as you can, be prepared. Wear earplugs, especially if you're easily distracted. That really helps a lot of people. Easy thing for you to do. Ask to sit at the front of the room or to a side if you're easily distracted. Most instructors are going to let you sit at the front of the room. It's when you ask to sit by a certain person or when you ask to sit at the back that we don't like to accommodate you. Start at the back of the test and work backwards. For people that are really stressed out about finishing on time, or they're just people that it really bothers them to go through the test in order, there's a couple of tricks. Start at the back, work back towards the front. Start in the middle. You can start in your favorite subject area. Most of the tests, except comprehensive, are arranged by subject matter. So start where you're most comfortable and then work from there. Please tell your school if you have a documented learning disability. It doesn't do you any good if you wait till the end of the course and you failed to say, well, but I have ADHD and I need to test somewhere else. You've already failed the course at that point. If you tell the school that at the beginning, then you complete ADA paperwork and you'll get accommodations, whether it's to start the test early, to take it in a separate spot, whatever it is. But it doesn't do any good for you to blame your failing on that or to try to appeal your fail on that learning disability when you didn't let somebody know. And lastly, take medication if your doctor advises it. I've had so many students that say, I've been really anxious. My doctor wants me to take this medicine, but I just don't want to take it. Nursing school is very stressful for a lot of people, and it really is just a season of time. So you can stop those meds when school is over. Just tell yourself, okay, I'm going to take the meds right now, and if that makes a big difference, then come January 2014 when I graduated, I'm done. So please, if your doctor's advised it, consider doing it. I thought it might help you to know what's different about comprehensive standardized tests, the HESI, ATI, NCLEX, any of those things. When you're taking those, you've got to go with your gut instead of trying to look for a trick in the question or the answer. Yeah, I've given you all these little tricks we do and how to deal with them. But if you try to analyze like that when you're taking a standardized test, you're not going to do as well. And it's because they're testing over a broad set of information. When we do unit exams, we've got to test a little more specifically and a little bit more details than we would on a standardized test. So we see more of that. The tricks, if you will, on those standardized tests are more distractors, quick things like you see a question that has Lasix and digoxin in it, so you immediately think digitoxicity, which you should, but if you then, and you might think potassium problems, but then you immediately go to something about potassium instead of reading it, and you might be picking something that says to limit potassium instead of to increase potassium. So that's where the tricks are on those standardized exams. Prepare by doing 5 NCLEX questions every day. Tons of apps out there that do this, free apps. Just do 5. That's easy to do. You get in bed, you realize you haven't done it, get up and do them. It'll take you maybe 15 minutes. Just the practice of taking them and seeing them over and over helps. Even if you haven't had the material, even if you're just in fundamentals, take them anyway and just see if you can start learning to reason through. Take them and then read the rationales after you complete the question. So take the question, read those rationales. That's where the learning really occurs. That's where you see what common mistakes you make, is by reading the rationales. The other thing is, read the rationales after you complete your standardized test if it gives you that option. And usually you have to do it right then. And what students tell me is, I'm just so frustrated after taking that exam that I couldn't even read the rationales. It just made me mad. And I get it. I appreciate that. But if that's the only time you get an opportunity to see them, you really need to try to do that and look for patterns. Look for the patterns like I teach in the Why Did I Fail That Test video. And then you'll know what to do better next time. Well, thanks for listening. I really, really want to beg you to give feedback. I see such a need for real teachers to give practical advice to nursing students, but I really want to know what you want help with. So comment, even if it's negative, that's fine. I got big, tough skin, big, broad shoulders. So suggest other topics you want to see, ask me questions, and I will work hard to reply. I'd love for you to rate our videos by clicking like or dislike. Share our videos if it's helpful to you with that simple little share button. And then subscribe to our YouTube channel so you can be the first to see the new videos that are coming out. We're also on Twitter and Facebook. And please, please send them to all your friends in nursing school. Like I've said multiple times, if you like this video, you might also like our Why Did I Fail That Test video. And watch for more med-surg topics, actually, instead of testing topics, med-surg topics coming out, and our app that's coming soon. Thanks again for watching.